Kat's not able to make it this morning, so I'll be facilitating the call this morning. We are recording this meeting, and I believe that recording has started. Today we're going to go over a few brief announcements, briefly review the newest data that we have to share. We've had some requests from schools to share a little bit of how the department internally decides when to consider a school or classroom closure. So we'd like to share that with you all, and then we'll save some time for question and answers at the end of the meeting. If questions do come up, you're welcome to put them in the chat. We do have some team members with us today that can be responding to questions in the chat. So we've been getting a lot of calls and emails regarding testing. We are still in a testing shortage. We had put in a large order for kits that has not arrived yet, so we're continuing to wait for tests. We are still encouraging schools to go ahead and put in requests through the request link, and as soon as we have tests, we'll be notifying folks for pickup. However, we did have an emergency closure today. Our warehouse is closed, and so please let any folks at your schools know that if they were notified to pick up tests today and they're headed to the warehouse is going to be closed. As everybody, I'm sure, is aware, cases are in high transmission. We're seeing hundreds of positive student cases every day. Yesterday, I think we topped over 1,000. As of a couple days ago, and now I see 2,400 new daily cases is on the slide. 11,360 cases in the county. We're at a 29% test positivity rate. Total staff cases in the schools, if we're looking at the schools data, 1,730. Student cases, we're nearing 10,000 student cases. We're seeing most cases are in the under 11 years old. And then we're seeing lots and lots of outbreaks. Thank you to those schools that are reporting those outbreaks to the school support email. We've been forwarding those notifications to our epidemiology team. We apologize if we're not able to get back to all of you as soon as we would like, but they are prioritizing all of the outbreaks and reaching back to those health aides, those teachers and principals that are seeing a high number of outbreaks. To date, 157 classroom closures have been reported to the county, and we expect that number to also increase this week. Before we get into question and answers, I'd like to share another screen. So I'm going to go ahead and switch to a different screen. Hopefully you all can see this. We've had requests to share when our EPI team is considering guidance in terms of a school closure, what factors they put in place. So those of you who have been writing to us and talking to us on the phone, you know that we often ask you for lots of numbers, including how many students are in the classroom. Typically, what the case investigators will do is they'll take a look at all the positive cases in a classroom and see what percentage of the entire classroom is testing positive. They take other factors into account, such as if the classroom is masking reliably, if the school is participating in test mask stay. They'll also ask questions for how many students are vaccinated versus unvaccinated. And so that's kind of the start to determine a threshold for when we might consider a closure. For other cases where we're seeing a low number of outbreaks, we'll continue to monitor those classrooms, but it might not be necessarily time to consider a classroom closure. We have sent out correspondence to the superintendents of your districts, basically encouraging them to take a look at all of their mitigation strategies that they have in place. We included a list of questions that schools should be asking to decide if they're able to meet, these mitigation strategies. These questions are things like, is the classroom able to enforce proper masking for all students and staff? Appropriate physical distance, maintaining at least that 3-foot distance is also important. We've been encouraging folks to look at their ventilation. Can that be optimized and increased? Can doors and windows be open, for example? Is staffing adequate to evaluate students who may be present with symptoms? We know there's a staffing shortage right now. A lot of teachers are out sick, a lot of staff are out sick. So that's another factor we look at as well. We look at the overall absenteeism to determine when it's no longer safe and appropriate to operate a classroom or a school for that matter, and how many students or staff are reporting COVID infections or COVID-like illness. We are still expecting schools to be contact tracing and reporting outbreaks to the county health department pursuant to the sanitary measure and the executive order from ADHS. We understand you're dealing with an overwhelming number of cases, so please do what you can. Let us know how we can continue to support you in all of those things. We've gone ahead and also communicated to the district leadership that they're welcome to ask themselves these questions. We know that schools, principals of the schools have the greatest insight as to how they can maintain these mitigation strategies and assess if it's time to consider classroom closure or school closure. They do not necessarily need explicit permission from the county health department to close a classroom or to close a school. If anybody has questions that aren't being answered in the chat, feel free to unmute. I will do my best to answer. Any other questions that we can't get to today, of course, we'll follow up in a follow-up email later this week.
Hi, I am wondering how we can determine whether or not there's classroom transmission or the students are just getting sick outside of the classroom, outside, because the transmission is so high. Like, how do we do all of our mitigation strategies in the classroom, we do proper distancing, proper masking, but in every single one of our classes, we have so many absences from COVID-19, but we don't believe it's from the classroom. We believe it's from the kids' parents getting them sick and families and going outside and going like out on the weekend. How do we determine that and then report it as an outbreak?
Right, that's a great question. ADHS currently defines an outbreak as 2 or more cases within a 14-day period that are linked at the school. If you can identify that they were in close contact outside of the school setting, so for example, maybe someone else in their household tested positive first, or maybe their friends outside of school and they were doing some event together outside of school, then that necessarily wouldn't be considered an outbreak. That executive measure expires, I believe, next month, and so we're also waiting to see if they're going to redefine what an outbreak is, because cases are so high and we have so many outbreaks. Currently, it's still defined as 2, but we're waiting to see if that will change. Thank you. If my team has noticed any other questions in the chat, feel free to speak up. I have not been following the chat. No. Okay. If no one has any other questions, we'll go ahead and call it a short meeting today. Feel free, as questions come up throughout the week, the school support at pima.gov. We have a team that is answering those emails. Also, our school support phone number, if I could ask one of my team members to go ahead and throw that phone number in the chat, is a great resource for nurses and teachers and parents. I will say parents that are calling the health department, most often we're telling them to defer back to their school. So just know, I believe our number is on the exposure letters that go out, the close contact letters that go out, and the outbreak letters. We're getting a lot of questions about school policy, and so we're asking those families to contact their school. We're able to offer clarifying guidance in terms of interpreting what the CDC has said and what our county recommendations are, but in terms of school policies, we're asking them to contact their schools.
I have a question.
Sure.
I know, I believe it was last week or the week before, you guys had mentioned that K through 12, if they were not boosted, they were still considered to be fully vaccinated. But with the updated forms that were sent out, it still has, in regards to being boosted, it's being fully vaccinated.
We're currently taking a look at all of our forms. The CDC also recently fleshed out a lot of their guidance in terms of who needs to quarantine and for how long. They also updated their 90-day guidelines for folks that have tested positive in the last 90 days. We're taking a look at all that. We're most likely going to be updating everything again. So I would expect everybody to receive updated letters at some point soon.
So we could follow the K through 12 not being boosted as being fully vaccinated?
Currently, the county's guidance continues to be that for students who have received their first 2 primary doses of their first Pfizer and aren't yet boosted, they're still considered vaccinated, fully vaccinated. That might change with the next rendition of our letters.
Okay, thank you.
Matt, this is Stephanie from Castle Hill. I think we talk about this almost every week, but with Omicron being so contagious, is there any updated guidance if a parent or a sibling ends up positive even for vaccinated students? I know that guidance says they can come back to school, but it almost seems inevitable that when they share a household, they're going to end up catching it. We've seen a lot of that in our community. Is it recommended that they stay home and monitor for symptoms, or can they still be in our classrooms? My teachers are really uncomfortable with that, and I just want to know the county's recommendation.
Yeah, currently we are taking a lot of calls also from families who need clarification with that, and we work through the timeline with them. If they're currently quarantining with a positive case in the home, it kind of turns into a rolling quarantine, and so we'll work through the dates with them, but we typically ask them to not count first day of quarantine until like the final 5 days of that initial positive case is over, and then they can begin day 1 or whatever. But it does get tricky because with the vaccinated students, we're saying that they're able to go back to school. Currently, we haven't had any updated guidance specific to that issue.
So if they're vaccinated, they're allowed to come to school even if mom has it at home?
Currently, yes. As long as they're wearing a mask, they have to be masking. If they're not able to mask consistently at school, they need to stay home.
Okay, thank you.
Hi, Matt. I have a question. It's getting it's crazy out there, and because we're so short-staffed, everything's more anxiety-producing than normal. If a mom tests positive, she's isolated, kids all stay home because of close contact. Mom is over the phase, a sibling tests positive. So I just continue this and the kids just stay home indefinitely as long as somebody in the household is testing positive? Or how am I?
This is Monica. This is
It could mean that they're at home for an extended period of time. For specific cases and scenarios like this, usually we'll reach out to our EPI team. So if you all have like specific cases that you're trying to navigate and determine how long a student needs to stay home and when they should come back to school, go ahead and shoot us an email or give us a phone call, and one of our team members can work out those specific scenarios with you. Most likely it'll be a member from our EPI team.
Okay. And the email to that is,
Yeah, the email is schoolsupport
okay, so it is the
at
school
pima.gov.
support.
Yep, same email.
Okay. Thank you.
And on her question, that would be for unvaccinated students only, right? Because the vaccinated ones can come back to school.
If they're vaccinated and able to wear a mask in school, they should be okay to go back.
Oh, okay. So if mom's positive, kids vaccinated, they're very good about wearing masks, they don't have to do the 5 days?
No.
Okay.
No, if they're vaccinated, they're able to continue attending school. If they're unvaccinated, that's when we have to look at staying home in the quarantine period.
Okay. And then the kid who's vaccinated tests positive, he stays home.
Yes. Regardless of vaccination status, if a student tests positive, they need to stay home.
And it's 5 days.
Yes.
Okay, thank you.
Matt, hi, this is Kathy Stanley. Can I clarify one more thing with the person that had the question about the positive case at home? Can the kids come if they're vaccinated? If they're vaccinated, they can be in school as long as they have no symptoms and they're masked. But if the child starts to not feel well, then they should stay home and be tested.
And then come back here. And
Yes, thank you,
It's possible
Kathy.
for them to have a breakthrough. And so I don't want people thinking as long as they're vaccinated, everything's copacetic.
Yes, thank you. That's an important clarification. Anytime a student shows symptoms, they should be home, just like any other illness. Symptomatic children should stay at home. Thank you.
We are seeing a big uptick in positives in our vaccinated students. And we have our policy right now that the unvaccinated kids need to have a negative test to come back. And I was wondering if you guys have any guidance if maybe we should also be asking that all even vaccinated kids, if they have to go in, like if we close that classroom to online learning, because we can't keep it open, should we be asking those kids to have negative tests as well, the vaccinated?
The county currently hasn't had any updated guidance in terms of that. Again, if that's something your school feels strongly about, and you have the ability to add that testing, and that's not currently the county's guidance. Yeah. Any other questions? I see a few in the chat. I'll do my best real quick. There's one about receipt. Oh, the chat's already moving quicker than I can read. Are we supposed to have a copy of a vaccination card or take their word for it? I'm actually not sure what each school has in place for these policies. I would assume that they're asking for vaccination records for all their students, and that would include a COVID vaccine. Let's see. I don't trust myself to not get lost in this chat, so I'm going to go ahead and let our team take care of the chat questions. Any that we didn't get to today, of course, we'll compile those questions into our follow-up email. We also do plan to send out this document I shared today, a version of it. Again, this is, for the most part, internal health department guidance that we're willing to share with schools so that they can see how we kind of go about making those decisions. I want to thank you all again. I know it's been a rough ride. It's tough out there, so please take care of yourselves and hang in there. We're rooting for all of you.
Matt, just one question before you go.
Yeah. Okay.
Do we see like a full school closure like we did last year coming with all the craziness that's out there right now and what's going on and all the pushbacks from vaxxers or anti-maskers or
at the county level, currently, we're committed to doing everything we can to keep schools open. As far as I'm aware, there hasn't been a discussion around closing down entire schools. Again, we've been trying to communicate to superintendents and the school leadership to work with us if they're reaching a point where they feel like they need to consider a school closure. We're hoping that they'll reach out to the county and we can have that conversation with them.
Matt, there's one more question in the chat that I think is really important.
Okay.
It's about school personnel coming together to complete the close contact line list and the amount of time that takes.
Mm-hmm.
Can you walk us through what you guys do with that information and the feedback that we're getting, how it's being used? Because it's disabling our ability to run the schools on lots of days.
Yeah, it's interesting you asked that because I was hoping to have one of our colleagues speak specifically about the line list today, and they weren't able to make it. I think it's safe to say we need to re-examine our line list process because we know with the current number of cases and the time it takes to enter that information, folks are feeling backed up, and we're a little worried on our end that those lists are becoming a little bit unreliable. The information is important. I will say that, like we use that data, it's used for contact tracing on our end. And so it's really important that schools continue to submit their line lists and submit them as accurately as possible and as timely as possible. We understand that with the number of cases, it's taking a little bit more time. So we are looking at that whole process and we'll let everybody know if changes are coming, but right now it's going to remain the same.
Matt, hi, this is Kathy Stanley again. I saw Anissa made a comment that we can always verify vaccines in ACES. I've noticed recently we're not having some show up. The parents are either saying, or else it's been employees that can tell me where they got the shot and when they got the shot. And when I look in ACES, it's not there. So some people, I think some of the providers, maybe just because of the sheer volume, like some of the Walgreens and Walmarts, I'm not sure they're making it into ACES.
Okay, thank you, Kathy. That's something that we'll have to follow up on.
Because I've had a couple of those and they're from reliable people that aren't just saying, yeah, I got a vaccine. And before everybody was getting entered, and now I'm beginning to see some where there's problems. So I just thought I'd like to bring it to your attention.
Okay, thank you, Kathy.
Thank you.
Sorry, Matt, I had a quick follow-up on the previous comment that you made per the line list. Since we are drowning, at a bare minimum, if we give you names and contact numbers, can we do that so that we can get through the process until you guys have reevaluated what the line list is going to look like?
I might defer to Anissa on this, but I think it's important that those line lists are submitted complete. We need complete information for those.
Sorry, this is Anissa from EPI. So I know that Matt Christenberry, I don't think he's on the call, but I heard that may or may not be changing. I don't want to give a final answer yet, and I apologize because I know the feeling of having to wait and get passed on, and we're not trying to do that. We just want to make sure that we're getting you the most current information, as it's not only changing for you all, it's changing for us, believe it or not. So if that does change soon, we will let you know, but I'm going to verify that with Matt Christenberry also. Okay, thank you.
Thanks, Anissa.
I know you guys are short and there was a hold on the shipment, but can you anticipate like when we would be getting more test kits to schools? Because I mean, people are having a very difficult time. It's what they report to me is that they're having a hard time finding tests. So it's great when schools have it. Do you have any idea?
I wish I knew more. Erica Spence isn't on the call today. I know that we're currently waiting on a large shipment, and I believe it's the supplier also is short. So we have the orders out. I think this is a national testing shortage where we have teams that are trying to source additional tests, and we'll order them as fast as we can. I think it's just a matter of supply at this point. So if we're able to source them, we'll get them and make sure to get them out to schools. Schools currently are the priority for the health department. So you all are receiving the tests that we have. And I wish we were getting more in, and I wish I had more specific times and dates to give you, but I don't today. I'm sorry.
Hi, real quick. My name's Heather. I'm a nurse at Rincon University High School. I understand that the actual tests are in short supply, but when you get them, is Pima County planning on upping their testing sites? Because while we have tests in the school, we don't have the manpower either. So I used to print 4-page documents of Pima County testing sites. It's down to 1 page.
Right. Yeah, I do believe that every couple of weeks we look at what our capacity is to increase testing, and so I know that is in the plans to try and increase testing sites. I'm not 100% sure where we're at right now, so I don't want to give any false information, but I do know that that's something they look at.
Hey Matt, this is Kat. Hi everyone. I just want to pop in and say that we have a team of people who are coming from FEMA, and I believe they will be doing PCR testing in Pima County, and I believe that will open next week. Don't hold me to that because they're still working out getting some of the FEMA staff here. And appointments and things like that. But my understanding is that they will be opening next week. So we are doing our best to expand testing options in Pima County. This will not be antigen testing though, so people will have to wait for results. However, I believe there will be a couple thousand appointments available per day. So yeah, as Matt stated, we do continue to try and expand our community-wide testing as well. So once we have more firm information about that, we will send out some communications. That will be on our webpage as well.
Thank you for that. That's helpful.
Thanks, Kat. Anissa, I saw your hand up. Did you have other comments that you'd like to make?
Sorry, I just forgot to put my hand back down. I apologize to everybody.
No worries. Okay, well, we are at the end of our time. If you come up with other questions, feel free to shoot them over to us. I did hear some concerns today that we'll bring up with our teams, especially regarding reporting and the line lists, and of course testing supply. So we'll make sure that is also discussed. Thank you, everybody.